Benzodiazepines, often referred to as benzos, are a class of psychoactive drugs commonly prescribed for their anxiolytic, sedative, muscle relaxant, and anticonvulsant properties.
Here I come.
Some well-known examples include diazepam, lorazepam, and alprazolam.
But wait! There's more!
Now, regarding the mechanism of action, benzodiazepines exert their effects primarily through the central nervous system. They enhance the activity of neurotransmitter gamma-aminobutyric acid, or GABA, which is the brain's main inhibitory neurotransmitter. GABA works by binding to the GABA-A receptor, causing an influx of chloride ions into neurons, making them hyperpolarized and less likely to fire action potentials. Benzodiazepines bind to a specific site on the GABA-A receptor complex, distinct from where GABA binds, and increase the frequency of chloride channel opening. This potentiation leads to a more pronounced inhibitory effect, resulting in sedation, anxiolysis, and muscle relaxation.
Sensational.
Because of this CNS depressant effect, benzodiazepines are effective in treating anxiety disorders, insomnia, seizures, and muscle spasms. However, their potential for misuse and overdose is significant. While benzodiazepines have a relatively high safety margin when used as prescribed, their misuse, particularly in combination with other CNS depressants like alcohol, opioids, and other sedatives, can lead to severe toxicity. Benzodiazepine overdoses alone are generally less life-threatening than other drugs due to a ceiling effect on their depressant action, but they can still cause significant morbidity. Regarding the symptoms of benzodiazepine overdose, symptoms range from drowsiness and confusion to deep sedation and coma, depending on the dose. Patients may exhibit ataxia, slurred speech, and altered mental status. Respiratory depression is less common with benzodiazepines alone, but can occur when combined with other depressants. At higher doses, benzodiazepines can cause mild to moderate hypotension due to their muscle relaxant effects and CNS depression. Respiratory depression is rare with benzodiazepine monotherapy, but can be significant in cases of polypharmacy, such as mixing with alcohol or opioids. This can lead to hypoventilation, hypoxia, and even respiratory arrest in severe cases. Although rare, paradoxical reactions such as agitation, aggression, or delirium may occur, especially in the elderly or those with underlying psychiatric conditions. Regarding the treatment of benzodiazepine toxicity, we start with the initial assessment and stabilization, beginning with airway, breathing, and circulation.
That's a great idea. I'm with that.
It's important to ensure a patent airway, support breathing if necessary, and assess circulation. Intubation may be required for patients with severe respiratory depression or altered mental status.
Oh, okay. Yeah.
Establish IV access for fluids and medication administration, and continuous cardiac monitoring and pulse oximetry are essential, especially in cases of severe overdose. One can consider activated charcoal if the patient presents within 1 hour of ingestion and is alert with an intact airway. This can reduce further absorption of the drug. Charcoal should be avoided in patients with a depressed level of consciousness unless the airway is protected by intubation. Now regarding the antidote, flumazenil. Flumazenil is a competitive antagonist at the benzodiazepine binding site on the GABA-A receptor, reversing the effects of benzodiazepines. It is usually reserved for specific cases of overdose, such as in patients who are naive to benzodiazepines, or when a benzodiazepine is the only suspected agent. Flumazenil is typically given in small incremental doses, such as 0.2 mg IV over 30 seconds, repeated every minute as needed, up to a maximum of 1 to 3 mg. It should be administered cautiously, as rapid reversal can precipitate withdrawal symptoms, including seizures, particularly in chronic benzodiazepine users. Regarding the contraindications of flumazenil, flumazenil is contraindicated in patients with a history of benzodiazepine dependence, those who are suspected of polypharmacy overdose, especially tricyclic antidepressants, or those with a seizure disorder.
I beg your pardon?
In such patients, supportive care and observation are preferred over flumazenil use. Now, regarding supportive care, ventilatory support is critical for patients with respiratory depression. Non-invasive ventilation may be tried initially, but intubation and mechanical ventilation may be required in severe cases. For agitation or anxiety, avoid additional sedatives until the patient's respiratory status is stable. In some cases, low-dose antipsychotics may be used. Intravenous fluids may be necessary to treat hypotension. Most benzodiazepines have long half-lives, requiring prolonged observation in an emergency setting. Patients should be monitored for a minimum of 4 to 6 hours after their last dose of flumazenil or until symptoms resolve. Benzodiazepines, while effective and generally safe when used correctly, can pose significant risks in the context of misuse or overdose. Recognizing the symptoms of toxicity and understanding the appropriate management strategies, including the cautious use of flumazenil, are critical for ensuring patient safety. The cornerstone of treatment remains supportive care and careful monitoring, especially when multiple substances may be involved. As always, keep your head up. You're doing great. You're better than what you were yesterday. That's a lot. Learn something new today. Gonna be a great doc. Sometimes you just gotta hear that. Are you an emergency medicine professional or a medical student eager to sharpen your toxicology skills? Well, look no further. EM Toxicology Trainer is your go-to app to mastering the essentials of toxicology and toxicological emergencies. With EM Toxicology Trainer, you can dive into the mechanisms, symptoms, and treatments of common overdose scenarios right at your fingertips. Learn what happens in the body when venlafaxine levels go too high, or how to handle a dangerous Tylenol overdose. Our app makes learning toxicology easy, with concise explanations that reinforce your knowledge to go. No more scrambling through textbooks or online searches when time is critical. Whether you're in the ER or prepping for exams, EM Toxicology Trainer gives you the confidence to tackle toxicology cases with precision and speed. Download EM Toxicology Trainer today and become the expert your patients need when it matters most. Available now on iOS and Android.